professor of physics of the University of Würzburg in Germany, and he never there was no idea, he had no idea, he was conducting a very simple physical experiment on the so-called Hitchcock-Crooker's tube, and he was making research, a kind of research of electrical discharge, and surprisingly, in that very day, Professor Röntgen, and because of that, sometimes we call those rays Röntgen, okay, Professor Röntgen inventing something unnatural in the next room from his experimental room, that the rooms were semi-darkened, because all of the physical experiments, you know, is conducted in a semi-darkened room. He noticed that on the next room, something glowing object was emitting the light on the table, and the situation was very suspicious, because the Crooker-Hitchcock's tube for his research was very far from that room. So the room of his experiment was far from the room where the table with this desk, something that was glowing, was placed. And he noticed that that object was emanating the light. And you know that emanation of light and the glowing is the phenomenon of fluorescence, so-called physical event, physical phenomenon, the fluorescence. Fluorescencia, this means that when something, the outer energy, the Fourier energy, acts on an object, it may emanate the light. So this was a good deal or distance, and Professor Röntgen was suspicious about this event, because his electrons on which he was making the research, that was emitted from the Hitchcock tube for his experiment, those electrons didn't possess such kind of energy to be transmitted through the cardboard that covered the tube and pass through the wall, and by the way reach that desk that was on the table, and that desk had an ability for fluorescing. So he was very surprised and decided, because of he was the scientist and had a very observative eye, so he decided that something very unnatural happened, and there was some invisible rays that possessed the sufficient energy, came out from the tube during the experiment, were invisible, and traversed the wall, even through the cardboard, and could reach to the table, to the object, or so-called fluorescent desk, that naturally could fluorescent. Okay, so after that invention, he considered that this was very special rays, and he called X-rays, because, you know, in mathematics and in physics, I will repeat, the universal term for unknown is X, Y, and Z. And he called this type of rays X-rays. And why rays? Because he was physics and knew that this type of invisible thing that came out from the tube and reached the desk in the other room, other than experimental room for his research, have the direct and straight direction, okay? And because of that, he called them X-rays. So afterwards, I'll make a little review because it is very interesting, from a very interesting and very beautiful story, in other words. So how those special rays, and very, very helpful for the, and very useful in medical science and medicines for the benefit of our patient and healthcare, is unique for us, for doctors, and for you also as for the future doctors. So afterwards, he conducted conspiratively researches on those rays. So he placed the object on the path of the so-called X-rays and observed those shadows of those objects on the fluorescent screen. And afterwards, he used his own hand on the path of the X-rays, and he noticed his the shadows of his tissue and the bones. So he decided that he made a very huge invention in the history of physics, and that this kind of invention would have a broad utilization in the for the future coming, and especially in the medicine. So he asked for the first image, first recording X-ray image, his wife. Please pay attention to this situation. This was Mrs. Bertha, the wife of Professor Röntgen, and it was her hand, Bertha's hand, the first X-ray image that is known in the history of radiology and medicine. So pay attention also to that event. That event is a very beautiful story. That when the Professor Röntgen placed his wife's hand to make the X-ray impression on the photograph plate. So she wore her wedding ring, okay? And this was a so-called sign, you know, the wedding ring, the first X-ray image of the wife of the inventor, the great inventor, Professor Röntgen. And since that day, you know, the radiology and medicines, the medical science, so comes together. A kind of a husband and the wife, you know, and this was a very unique, from my point of view, this was the very unique event in the history of the physics, and more than in physics, maybe we in medicine have the utilization of this rays, this special rays by which we can see anything, and especially nowadays when the technology in the field of radiology, in the field of physics and medical science also are very, very advanced, and we have specialized apparatus and machines by which we can observe detailedly any changes, any pathologies in the human body. In the human body, you know, and you agree with me that this invention was very special for the medical science. So in any field of medicine, we use the X-ray films, we use the radiation, by the way, and especially X-ray films. So beginning from dentistry, because we are the dental staffs, so members of the dental discipline, beginning in dentistry, from ordinary very apical X-ray images, and the digital sensors or the little X-ray films, where we can identify and see the tooth, the structures of the tooth, enamel, dentin inside the pulp cavity, and surrounding bony tissue, can identify the carious decay, can identify the periodontal changes, for example, or inflammation. So the panoramic X-rays, for example, maybe someone have ever presented to that types of X-ray imaging, so where the whole structures of the upper lower jaw bones and the frontal bones, by its way, the joint, temporomandibular joint also can identify with teeth, of course, the upper and lower jaw teeth. And all of the gross anatomy, that is very helpful, especially in orthodontics. So beginning from that, and more advanced technologies such as CBCT, and you know that nowadays the implantology is very popular in dentistry, and there is no concern from the patients when they use their teeth that they are the patient of the prosthetics that was very prosthetics, the ordinary, the conventional prosthetics, you know, that was very bordering for the patients. For example, 15 years ago, they may now lose the teeth, but it's not painful because the situation will be corrected anyway. We have the implants, and for inserting the implants and for adequate treatment planning, we use the CBCT or cone beam tomography X-ray imaging technique. That is very helpful to identify what kind of implants, what type, what size, and where it has to be implanted in right way. And in this situation, the CBCT scanning also that uses the X-rays, our beautiful X-rays that was invented by the professor, this very special professor that I love much. So Professor Röntgen, and also I have to mention that this man was a very noble gentleman, and after his invention, he was against that because there is a special protocol that the man that invents, that makes invention, this invention is called after his name, but he was against it because he was a real scientist and he made the huge benefit, gave the huge benefit for us, for doctors. So then I will also return to the CBCTs, and nowadays the CBCT scanning is very popular in dentistry, as you know. So also we have mentioned the MRI, that is also the examination type of examination, also used in dentistry, and especially in oromaxillofacial surgery, to identify any cancerous soft tissue defects in the field of head and neck space. So for the first, I wanted for you to make the emphasis about the meaning, about the huge meaning of the radiology, X-rays and radiation by its way, for us, for doctors, totally in every field of medicine, and especially in dentistry, because nowadays there is no proper treatment in endodontics, and you know maybe that endodontics is the treatment of root canals, okay? And even in treatment of root canals, ladies and gentlemen, dear future doctors, I'm sorry, dear future doctors, we use the CBCT scanning. And it depends, you know, it depends upon the situation. Of course, it depends upon doctors. how to manage, how to choose what type of X-ray imaging must be conducting on the patient. So these lectures and this background information is contained in these books that gives you an ability to understand and to clarify what type of X-ray imaging will be better for you in that situation to make a decision and will be affordable for your treatment plan. And if there is no suspicion that there is something wrong with periapical tissues, maybe you will need and send your patient for advanced X-ray imaging to make the routing diagnosis. So why did I mention this? No, why did I mention your importance of your decision according to patient? Why did I mention? So I explain now, because besides its benefit, besides this benefit from the X-rays, it has the radioactivity. It is radioactive, in other words. And you know, when we are dealing with radioactive objects, there is the special signs, by the way, that indicates that there is the radiation. You can cross that border. Okay, so besides we use and utilize effectively the radioactive waste, we have to know that they contain hazard and that may be very harmful, even more harmful, not only for the patients. Of course, for the first place, we place the patient and its health, but also for the personnel and the staff members that occupy your dental office. So now we came to that point. What is radiation itself? Why it is so useful, and why we have to know how to use it with safety and with correct way, never to make harm to our patients, and of course to make us and our staff members, especially operators, to keep them away of radiation. So maybe all of you know something about radiation, and I'm sure that you know the harmfulness from radiation. And at this point, I also want to make a little overview towards its harmfulness. I'm sorry. After invention of X-rays, the whole world was presented to that beautiful invention. The other disciplines of medicines utilize this X-rays for their imaging, for diagnosis, and so forth and so forth. And of course, this type of invention was acquired by the dentists also, and they utilize this X-rays for making the imaging on the jaws and on the teeth, by the way. So, and I want to mention the name of the doctor. This was Dr. Kelly in USA. I'm sorry, in USA. The one of one of the doctors who utilized very, very often and successfully, may say, these X-rays to observe the changes on the jawbones and on the, he was making the X-rays on the teeth, I say, but before conducting on this patient and using on this patient, he made the experiments on himself. And unfortunately, because in those days the utilization of the X-rays was there was no safety, and those people knew to what they were dealing, that this was radiation, but they have no ideas of protection. And because of that, those persons, unfortunately, who were presented to the radiation, unfortunately, those persons very often died from cancers. And this Dr. Kelly, who conducted the experiments in experimental way, sometimes in patients, because they could not control the dosage of the X-rays, during the exposition process. And of course, besides the dosage, they could not operate with time, and to make the X-ray imaging on the heart tissues in those days, it needed much time. Just imagine, approximately 20 minutes. It's unnatural and unbelievable. 20 minutes you stand under the influence of the X-rays. Immediately, the summary effect for this situation will be very harmful, and ultimately those persons become irradiated, and unfortunately, Dr. Kelly died from cancer. So, in other words, he killed himself, and he committed suicide in his dental office. But he stated that he knew his condition, his health was worsening, but he never minded, because he knew that he did this for the benefit of, for the future, for the health of the patients, and so forth and so forth. So it's a very good person in this way. So why did I made the emphasis by remarking this story? Because when we are dealing with X-rays, and we know the benefit from the X-rays on the requiring the X-ray imagings, we always have to know the regulations that we have to follow, and all of the staff members have to follow those regulations, because in any way, maybe the dental X-ray is not so harmful. It may, in this summary, the effect, if we will have no protection, then we will acquire, and seriously, this kind of situation, we may acquire a sufficient radiation from the exposure, and something wrong with our health will go on. So this the topics and the basic information that is given in this literature, this radiologic, oral and maxillofacial radiology, gives you also the information and the knowledge how to protect yourself, protect your patient, how to operate with X-ray machines, with CBCT scans also, and how to manage with to choose what type of X-ray imaging may give you the benefit for treatment planning. It's very very unique for you as for the future doctors to identify, to make a right decision, to protect your patient from external and additional radiation. So why do we make an emphasis about radiation? What is this? What is a kind? Why it's so harmful, the radiation? As you know, the radiation itself is an external energy, is an energy that that passes through electromagnetic fields. So this is the energy. So for clear understanding, I will begin from the structure of atom, from the composition of matter. So let's share the screen, ladies and gentlemen, and let's say this, share the screen, and please, I want you to pay attention on the figure 1 and 1, and please tell me if you see in the right way this figure. Maria, do you see this 1 and 1 figure?
No, I still can't see.
You cannot see. Al Muhammad, Amer, Hussein Ali. Can't you, all of you, identify that figure?
No, doctor, we cannot.
Oh, you cannot
Sure,
see. That is the disadvantage of online lectures.
Yes.
That is a very, very disadvantage, big disadvantage, because I want to explain you and remind maybe all of you know the structure of atomic structure. Do you know the atomic structure? The proton inside, the electrons outside, moving.
Oh yeah.
Of the shell. Okay, we cannot share the screen, unfortunately. I will try. I will try again and again, okay? So this was very exciting story about invention of the X-rays. Do you agree with me?
Yes.
Yeah, very, very exciting story. And that sign with the wedding ring was very astonishing. Because since that day, medicine and X-rays are together, radiology are together. So as one family. So I cannot make the... I will try again. Okay. I will try again, try more and more, but there's no ability. So, okay. Okay, we cannot share. I will try again. But there is no use, I think. So, okay. Now I will I will remind you, make a little overview about the structure of atoms. So, and composition of the matter. The matter. What is the matter? As you know, the matter is anything. It's an overview from physics, because you know that medicine as a discipline, as a life science, in the crossroad of every life sciences, physics, chemistry, and biology, and so forth and so forth, and especially in radiology, in this field, the knowledge of physics a little bit maybe is inevitable for us. So I will remind you a little, okay, a little about atoms. So for the future, I will try to manage with the sharing the screen, because it's very hard for you to understand this, okay? So matter is anything that has a mass, and occupies space. What gives the matter the mass? So the very little particles, as you know, that is the indivisible constituent part for this matter is atom. This elementary particle. And you know, this elementary particle, the atom consists of the nuclei and the electrons that surrounds, inside the atom surrounds the nuclei. And the nuclei consists of protons, also the elementary particles, and neutrons. So we have protons, neutrons inside the nuclei, and electrons. And what are those particles? You know that neutrons are neutral particles. They only have the mass, but they have no charge. But the protons, one of the main particles constituent of the atom, the protons have the mass also, and they are charged particles. And as we know, the protons are charged with positively, okay, positively charged particles. So the nucleon contains positively charged protons and negative and neutral neutrons. And the mass of the atom, as you know, is calculated by the summary of protons and the neutrons. And the stability also we have to mention, because the stability of the atom defines the radioactivity of the atoms. Why? Because the mass of the atom, as we have mentioned before, is calculated by summary of the protons and neutrons. We don't need the charge in this moment. We need only calculation of mass. Depends, so the atomic number of the atomic mass of individual chemical elements depends upon the summary of the protons and neutrons. Okay, Doctor, which page in the book are we in right now? I'm sorry, I cannot find it. The composition of matter. Okay, you can find it by composition of matter. The titling is composition of matter, and there is a figure 1 and 1, and you can find that presentation. First chapter, yes, this I think that this is the first chapter. First chapter, physics. It begins with physics. The topic begins with physics. Sanjay and Malia. Okay. So why did we mention the mass? Yes, why did Farao radiology principles? Yes. That's right. So why did we mention the mass and the atomic number? Because the high atomic number, especially high atomic number, the elements that possess the high atomic number or high atomic mass, they are unstable. This is a physical phenomena. These elements are unstable, and it means that the elements that have the high atomic number, for example, iodine, or if, for example, the polonium, for example, uran, and the worldwide, you know, the radioactivity characteristics of uran, it is very, very radioactive element. So because of its decay, consistently, uran, because of high atomic mass, it undergoes changes inside the nucleus, and during this interaction between the protons and neutrons of high weight, it undergoes decay, and during this decay process, the energy is emitted, and this energy that is originated provides the radioactivity of these elements. So this is the restricted, this is a special type of radioactivity as a gamma radiation, for example, so forth and so forth. But for the X-ray radioactivity, and so for the generation of the X-rays, we are dealing with other elements inside the atom, and these elements are charged particles around the nucleus, and those particles are negatively charged, so protons are positive and electrons are negative, and outside the nucleus, and those elements are, those particles are electrons. And as you know, the electrons are negatively charged particles that move around the nucleus on the special electronic levels as defined by the quantum mechanics. So this is a part of the physics. So pay attention to the electrons now, future doctors. Why? Because on the every shell, and you can find in the text also that in every shell around the nucleus, the first shell, the second, the third, and the shells are have the very strange forms, by the way. So on every shelf, we have two electrons that are moving oppositely by each other, but move always around the nucleus, because the positively charged proton that attracts and holds the negatively charged electrons by its side closer to nucleus. So now we understand that those electrons that are closer to nucleus, to protons, they are tightly bounded to the nucleus than those electrons that move on the other distanced shells of the inside the atoms. So those electrons, by the way, we have to mention the intensity of motion of the electrons is very, very intensive, just closer to nucleus, closer to protons than outside shells. So the energy, the outer and external energy that is needed to break down this connection must be enough to make those electrons that are closer to nucleus, closer to protons, to be repelled from the inner shells of atoms. So that's energy that is needed to detach the electrons from the protons we call ionizing energies. Why ionizing energy? So we came to that point. What does it mean, the ionization? What is the ion? We know that atom, this very, very indivisible part, as it was known 100 years ago, so atom is stable. Atom is neutral when the charge of the proton equals to the charge and the summary number of electrons that surrounds the nucleus. So this atom is neutral. But when foreign energy or external energy comes outside and makes the electron to be repelled from its shell. So you know the electrons and protons are connected to each other in the atom with electrostatic forces. Okay? Electrostatic forces. Okay? You understand? I'm sorry, I couldn't read something. Okay, so the energy that comes from outside must be sufficient. You know, it must be sufficient to reinforce. Yes, everything is fine, thank you. Okay, so can you follow my explanation, ladies and gentlemen? Okay, so this external energy must be sufficient to break down that connection, to overcome that electrostatic energy, okay? Electrostatic energy. And this external energy that makes the atom to lose the electron, provides the neutral atom to be converted into charged particle. So when we talk about the ion, we have to understand that the ion is never the neutral atom. This is the charged particle, okay? And when the atom loses the electron, it is converted to ion, okay? So-called positively charged ion. And we just receive the electron that moves freely and also has acquired the energy. So we have charged particles, and now we understand that that external energy that causes this type of changes inside the atoms, because of that phenomena, we call ionizing energy. So just keep in mind that this characteristic is possessed not for any type of energy throughout the world that surrounds us. So the ionizing characteristics, from which page you are explaining, unfortunately I cannot present this now, but you can find in it is a first chapter number 1. Okay, this is the chapter number 1. There's discussion about physics. So this, okay, page 34, maybe QK. Okay, so this is the ionizing characteristic that makes the atom, okay. So that makes the atom to be converted into ionized form, the charged particle to be formed into charged particle, positively and negatively charged particle. And you know, this external energy has a huge type of influence on, especially on the living things or living substances, so forth and so forth. And this kind of characteristics is that that the X-rays are special, you know. So now we understand why the X-rays is hazardous for the living beings, because it may cause the ionization. So X-rays are possess the ionizing properties. By the way, you can ask me, for example, the visible light. Also, they represent a type of rays, okay? But the visible light doesn't possess the ionizing radiation, okay? Ionizing property, okay? So also there are the radio waves, for example. The radio waves also doesn't anyway possess the ionizing effect on the living things. But for example, the ultraviolet light, okay? For example, the gamma radiation, that is very broadly used in cancer treatment, unfortunately. So we have to mention this. It does possess the ionizing effect. So these are the ionizing energies that possess the ionizing effect, that has the ionizing effect on the living things. So because of that effect, that gives us an explanation. Yourself is something. Okay. Thank you, Isam. Thank you. So ionization. Now all of you can see the shared screen. I'm so happy seeing this. Okay. Isam has shared the screen. Okay, Ali. So ionization, that's right. And ionizing radiations. So there is stated that high energy particles, as I have, so alpha and beta particles, it's no use for you, okay, when you, it's no use for you to remember or to pay attention. So the meaningful for you is that to make an emphasis on X-rays and its characteristic as an ionizing, as a member of ionizing radiation, okay? Okay, ladies and gentlemen, so Isam, Isam, can you scroll down, Isam? Please, if you are so pleased. Okay. So there are some parts from this topic, ladies, the future doctors, I'm sorry, that we have to make the emphasis, and there are some other parts that has no use for us, okay? Okay, so I will try for you to make an indication on which part of the topic you have to pay an attention, okay? And which part of this topic has the special interest for us. Because the questionnaire and the questions, okay, the questions come especially from those parts on the midterm exams and afterwards on the final exams also, okay? So, Isam, if you are so pleased, to scroll down. Okay. So this is a little bit a review about the electromagnetic radiation. And as those types of energies, as for example, X-rays, so gamma radiation and so forth, and then any type of, please stop, please, saying thank you. So any type of radiation, electromagnetic radiation we call, it has the sufficient energy for ionization, they just move in, move in direction in the crossroad of the electric and magnetic fields. So because of that, we also use the electromagnetic waves, because it's spread in a wave manner, and electromagnetic because there are two crossing fields, electrical and magnetic fields, through which the these spatial waves are distributed. So please scroll again, Isam. Scroll down. Okay. So there is then a presentation. There is a presentation about relationship between energy, wavelengths, and electromagnetic radiation. So the wavelengths, as you know, for example, the X-rays, for example, in difference with the gamma radiation, okay, in difference, in contrast to the gamma radiation, have not such a very big, very short wavelength. That when we have to mention that those types of radiation that have the shorter wavelengths, they are more hazardous. So then the other types, for example, the radio waves, they are very, very slowly distributed and slow oscillations. So it is not, it doesn't possess the ionizing effect on the living things. So also we do not need this type of equation of relationship between energy waves and electromagnetic radiation. It is clear that X-rays, by the way, have and does possess the ionizing effect on living things, on substances. So there is an explanation of so stop please. So this is a very, very kind topic that we have to know. This is the construction of the X-ray machine. And as you know, in ordinary dental offices, we use the X-ray machines. Maybe in every office there shouldn't be the CBCT scans because of its high price. because, for example, the very perfect type of CBCTs may cost up from 60,000 to 80,000 euros. But the X-ray machine, the ordinary for operating with it, is very simple also, and we will have the ability to see our clinic with digital sensors. By the way, the X-ray machines are inevitable for every dental office to be equipped, you know, and it consists of, please, Isam, scroll again down. No, that stop. So stop, please. Thank you, Sam. So this is the ordinary, and maybe you have seen and were presented to that type of thing that we call the X-ray machine. So you can see that you had the major part of this X-ray machine from where the X-rays are originating. So, and came out. This is the X-ray tube head. The tube head with sensor hanging. Okay. Okay, stop, please, Isam. That will be for a little time. So then there is, you can see the arm by which the tube head is mounted on the wall. So, and the desktop with sensors, of course, that shows you the amperage, that shows you the time, because the timer is mounted inside also. And when we want to make an impression, for example, of the different tissues, the upper or the lower jaws, sometimes we choose the special, time, we change the time, and operators can freely change the timer. And in some machines, the time and amperage is set, is fixed, is fixed, and in other situations you can change this set of time and fix other amperage. It depends upon the tissues you want to make the image. Because as you know, so we came to that point that, as you know, when the X-rays traverses the soft tissues and hard tissues, and we have, all of you have seen the X-ray imagings, okay? And we would not make the definition, what does it mean, and so forth, because it's clear when we see the X-ray imaging, we see something white and something black, okay? And especially the range of white and black colors. What are those black and white colors? The white colors represent, in most cases, thank you, Hussein, just so we'll stop on that figure. The white color represents the hard tissues, and the black ones represent the soft tissues, okay? Or the shadows, especially. So, for example, when we see the tooth on the elementary periapical X-ray imagings, so X-ray films, as we call it, we can identify the white part that we see on the X-ray imagings, and it is a tooth structure. Enamel is the very hard tissue in the whole organism. Then comes the dentine, okay? And inside, we cannot see anything. Inside the tooth, we can see the black color, okay? Inside the tooth on the X-ray imagings is transparent because it is occupied with soft tissues and especially the pulp. So now we understand, we have to understand why this occurs. Because the hard tissue absorbs much radiation than the soft tissue. If we, for example, take the same thickness of the hard tissue and the soft tissue, it doesn't matter the thickness. the absorption of the X-ray photons by the heart tissues. The photon is the elementary part of the energy, the constituent part. Thank you, Yasim. You are very active, darling. You are very, very helpful. So, yes, thank you. Since this is a disease tease, okay. So, good job, Isam. Yes, of course, good job. Isam helped us in this situation. So, he's a good dental future, Isam, for you, huh? I can tell you so. So the heart tissue, yes, thank you. So the heart tissue absorbs more photon because of containing calcium, okay? And soft tissue are more transparent because they are traversed by the photons, traversed by the photons of X-ray beam without any retention. And why, again and again, I repeat, and I have to mention the ionizing effect of X-ray beam and X-rays. When the photons react on the atoms of the living tissue, it acts on the electrons, and because it contains the energy. So, and it transmits its energy. Thank you. Yes, of course. It transmits its energy, the photon, the X-ray constituent part possess the energy. It transmits its energy on the electrons, that is on the outer surface or inner shells or the atoms of the living tissues, and makes it to be repelled from the surrounding tissue, okay? And as much action of the photons on the heart tissue will be intensive, the intensity shade on the X-ray film will be characteristic, okay? So because of high consistency of the calcium in enamel part of the tooth, we can see it, yes, we can see it as more white, more dense, colored on the X-ray imagings. In contrast to, for example, dentine. Yes, in contrast to dentine, and especially, yes, it's much more gray, okay? Because the constituent of the dentine tissue is less than calcium content in enamel, okay? And because of that, it looks like gray than enamel tissue on the X-ray imagings. And now you see inside part of the tooth, the black lines. These black lines corresponds the pulp tissue. Why? Because the pulp tissue, that is why when we fix our teeth, it appears super white. Yes, of course. So, yes, of course, these are the restorations. Isam, the part of the tooth that you have shown, those are the restorations. So because the restorations are very radiopaque, very radiopaque, and more than an enamel, okay, because it's chemical consistency. Yes, so, and when we talk about pulp, the soft tissue, the absorption of the photons of the soft tissue, in contrast to the hard tissue, is less. And because of that, we see as a black shadows our pulp cavity and the root canals. So, the different absorption of the X-rays by the soft and hard tissues gives our contrast effect on the X-rays. Thank you, Isam. These very good examples for the radiograms. Okay, the panoramic X-rays are shown very clearly. And this is a very special patient, I think. Okay, that you have shown. So now I think you understand. Yes, now I think you understand what phenomena defines the effect of contrast on the X-ray imagings. The effect of contrast depends upon the absorption of the photons, the different absorption of the photons by the soft and hard tissue of the human being. So if you want to have a little break, do you want to have a little break? Because nearly an hour, yes, of course. Because Isam is managing with showing us the photos of the X-ray imaging. IT technician, let us stay here. Okay. Okay, Sam. So you can tell me if you have any questions towards our this topic and the explanation according to radiation, or about yourself, because I don't know you. Besides, we will have much time to. Okay, everything is clear. Till now, everything is clear. Okay, that's very good. You know, it's very. Oh, no questions, Maria. Okay, Zain also. So you are listening very intently. It's very good. So I want to, you know, to find the connections between statements, because I know that it's very hard for you to understand. For example, in topics it's separately given for you. For example, ionization, the definition of ionization, for example, and what, why do you have to know the ionization phenomena? What's the usage? You see the ionization phenomena in radiation, for example, and sometimes the students cannot make the connection between these phenomena, you know, between these options. I understand it's very hard because it is a part of the physics. Okay, we, the doctors, see only the results. We see the X-ray imagings. So we see the X-ray imagings at first, but we don't know how it occurs. It's very curious, yes? You agree with me? To know a little details about origination of X-rays. So afterwards, we will have a little speak about generation of the X-rays. Is also very interesting and very useful as for us to know. It's totally the physical event, totally the physical, the part of physics, but also is very helpful to identify how the X-ray machine works. How the X-ray machine works, how to operate with the X-ray machine correctly, and how to manage with safety and follow all the recommendations to keep the patient safe and from radiation, for unwilling radiation, external radiation, excessive radiation, to protect the patient and also the operator and the staff members. Okay? Because all the radiation that is emitted during the whole year is estimated by the special organizations. So, and you in your dental office, the emitted radiation, recorded emitted radiation, does not exceed the limits. Okay? That we will deal with practical lectures for this course. I hope that we will have the opportunity for practical lectures. And I want to know, all of you are in Georgia next time or just abroad? All of you are in place or abroad and connected only Lebanon? Okay, Tina, we're abroad. Okay. No one is in Georgia. Okay. Maria is in UK. Okay, Republic. So we'll try to manage with this. I will try to make then little recordings from our clinic. As you know, the New Vision University has its own clinic, well equipped. Okay, 7 yet. I'm sorry, I couldn't understand. Fanar, you wanted something to tell me? I didn't remember to identify it. Place. Yes, is the place. Okay. So, and we will try to give you the presentation from our clinic, okay? Because we will deal with the explanation of how does the periapical digital sensor work, and it will be a little bit hard for you for you to understand by only presentations, you know, and understand it in books, because it is a manipulation and you have to see it. Yes, of course, on the YouTubes they are share the screens from, and you can find anything on the YouTube, but we can explain it in the way for you to be very clear. Yes, how important dental X-rays are.
Dental radiographs or X-rays are very important to show things to the dentist that we cannot visually see inside your mouth. Especially with bite wing radiographs or X-rays, these are going to show the surfaces where your teeth are touching and that we cannot visually see, to show the starts of very small carious lesions or cavities. This way we can tell you what areas you need to work on with your brushing and flossing to possibly stop that lesion from growing before it would possibly grow to the size where you would need a root canal or the tooth to be extracted.
Yes, thank you. So the several times. So on the YouTube, it's very helpful, by the way. It's also very helpful. Thank you, Isam. Thank you, Isam. So afterwards, we will deal with pathologies. Okay. Afterwards, we will deal with pathologies and their appearances on the X-rays. Okay, so the break, as you wish. We may continue. Or just you wish the break? I refer break. Okay, Isam refers breaks. He's tired. Everyone, okay. Just make a break. 10 minutes. Okay, let's give you 10 minutes.
La 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 la.